How's it going, guys? Difficult question, Repro, Genitourinary. 10-year-old boy, 2-hour history, right scrotal pain, tender right hemiscrotum, blue-colored mass visible through the scrotal skin near the superior pole of right testis. Palpation of the inner thigh demonstrates retraction of the testes bilaterally. This means the patient has an intact cremasteric reflex, and it means choice C, testicular torsion, is fucking wrong. Okay? So you'll have an absent cremasteric reflex and testicular torsion. It's genitofemoral nerve. Palpation of inner thigh causes retraction of testes. And the reason this is important is because in epididymitis, an important differential, which is wrong in this case, you do have an intact cremasteric reflex. Okay, it's not right here, but you got to know that. So intact cremasteric reflex of epididymitis, it's not intact for testicular torsion. The demographic is not consistent with epididymitis. It's usually teenagers or older. Sexually active chlamydia, if they give you over the age of 35, tends to be E. coli. So for both epididymitis and prostatitis and USMLE, if they give you a dude who's, let's say, 45 years old, they want E. coli, not chlamydia. The organisms are similar. So your first point, torsion, absent cremasteric of testicular torsion, choice C, absent cremasteric reflex. Epididymitis, your cremasteric reflex intact. Also, there's something called Pren sign, P-R-E-H-N sign, where elevation of testis relieves the pain in epididymitis, but it does not relieve the pain with testicular torsion. Okay, so the cremasteric reflex and Pren signs, but they're both wrong in this case. Now, choice B, incarcerating inguinal hernia in pediatrics, that'll typically be an indirect inguinal hernia. So it means you have the small bowel herniate lateral to the inferior epigastric vessels, and it's going to go through the deep inguinal ring, through the inguinal canal, down through the superficial inguinal ring into the testis. Okay, that contrasts with direct inguinal hernia. Tends to be older men, and it's a weakness in the abdominal wall. It's going to be medial to the inferior epigastric vessels. Wrong fucking answer. Choice D, torsion of appendix testis, correct answer. This is the blue dot sign. Okay, so you have blue discoloration, superior pole of testis, and you have an intact cremasteric reflex. Okay, so I don't know what to tell you. It shows up on one of the NBME exams. Torsion of appendix testis, holy shit. Okay, but we eliminate to get there. And if you know the blue dot sign, it's buzzy and easy. I talk about it in my PDFs. Go to my PDFs. I mention it. Okay. So you've got this structure called the appendix testis sitting on the testis, not trolling, and that contours as well. But if you think it's weird, take it up with the NBME. Don't take it up with me because it shows up. Choice C, varicocele, is fucking wrong. So dilation of the pampiniform plexus, draining the testes, and they want you to know it occurs on the left more than the right, and that's because you have the left testicular vein drain at a 90-degree angle into the left renal vein before the left renal vein goes to the IVC, whereas the mnemonic right to the IVC on the right side, you have the right testicular vein go right to the IVC, so you don't have that renal vein in the middle with the 90-degree angle, so there isn't the same pressure backup. But there is a question on one of the 2CK forms where they give you bilateral varicocele. It's weird, okay? And you need to know that nephrotic syndrome can cause renal vein thrombosis and increase the risk of varicocele as well. And if they ask you for, and the reason nephrotic syndrome is hypercoagulable state because you're losing antithrombin 3 in the urine. So you get renal vein thrombosis, can lead to varicocele, it shows up. And the other thing is they like asking for the mechanism of subfertility/infertility with varicocele, and it's just increased scrotal temperature. That's all it is, okay? Just dilation of the veins, impaired drainage, slow drainage, increases scrotal temperature. Wrong fucking answer. You know the deal. I'm 2 member content. Let me switch from show. Appreciate your time. That's it.